Okay. Okay. So let's kick off by hearing a little bit about each of you, Danny and Dr. Birnbaum. Why don't you both just very briefly introduce yourselves? I know that I shared the basics, but really what I'd love to hear, and I hope others would be interested in, is really what inspired you to do the work that you do today. So Danny, why don't we start with you? What brought you to this work?
Hi, my name is Danny, and it was around 2014, around my 25th. I was 24. I was part of an on-track program, which I now work with in a different chapter, and I had an experience that was really hard to describe even to this day. Uh, the one thing that kind of helped me was that I knew that there was some way to deal with it, but I didn't know how. And that's when I asked for help. I asked my family members when I could. There was a lot of confusion during that time, and I enrolled in an on-track program, and I think I was meeting with a psychiatrist, psychiatrist like once every 3 months, a therapist like once a week, and I learned a lot of stuff. I learned a lot about myself, and I got a lot of tools. And then the program for me ended around the 2-year mark, and at that point I kind of told myself that I had to do good by a promise I made when it was beginning, which was I wanted to give back to the people that helped me. So I got in contact with my C's, and he told me about the peer role and said that he think I would be a perfect fit, and it turns out I was. So I definitely started my journey not knowing where I'm going, but now I have a pretty good idea where I want to go, and I think that makes me proud to be a peer.
Wonderful. Thank you so much, Danny, for sharing. Dr. Birnbaum, how about you? Tell us a little bit about your path to
Sure.
becoming a child and adolescent psychiatrist.
Yeah, thanks so much for having me. And I've been working with Danny now for a couple of years now, and he's just been such a wonderful addition to the team. Thanks for that, Danny. I always was interested in psychiatry. I knew that was what I wanted to do, and then when I got a little bit more exposure to it, I became incredibly fascinated with schizophrenia in particular. There was something to me that was incredibly powerful and moving, and it was so clear that there was so much we still needed to learn and needed to do in order to improve the care that we were providing. And throughout my training, I became increasingly aware of the lack of resources, especially in New York, where I did my residency and my child and adolescent fellowship. I had come from Canada, where I was exposed to an early intervention program there in Montreal, and I was really moved by the philosophy and the level of hope and optimism that existed within that program. And I was shocked to see that there was very little of that at the time in New York and really throughout the U.S. And I just became acutely focused on changing that. And very early on, during my residency, I became invested in changing that and started developing services. And I applied for a grant early on, and we were able to build a real clinical program dedicated to improving trajectories. And I've been invested in developing and improving those resources since then, and it's always been a source of incredible inspiration and excitement. And now, about a decade later, I'm happy to say that I can't say that anymore. There are now services all over the U.S. available to individuals with early psychosis, and it's really special to be able to be a part of that wave, a part of that movement, to keep moving psychiatry forward in the right direction. We clearly still have a lot to learn and a long way to go, but I'm inspired and motivated to be part of that process on a regular basis.
That's fantastic. Thank you so much, both of you, for what you do day in and day out, and also for being a part of Strong 365 as advisors, and today for sharing. So clearly this is an unprecedented time. None of us have gone through this before. There's so much stress and worry for people. We're facing health risks ourselves, which brings fear and trauma and grief associated with long periods of being alone, caring for people who might be sick, grieving people who we may have lost. I saw a statistic the other day that 50,000 kids in the United States are stranded at home. And on top of that, as of today, we got a new jobs report, 38 million Americans have lost their jobs in the last 2 months. So it's kind of mind-blowing. It's actually kind of hard to really grapple with these kinds of numbers and the experiences that we all have, whether it's walking down the street or trying to get groceries or whatever you're doing. It's hitting hard, especially for the most vulnerable people out there. And I'm wondering, in particular, since we're talking about young people today, what can they be doing to manage stress? So Dr. Birnbaum, we'll kick off with you. How are you encouraging your program participants and patients to stay emotionally and mentally healthy through the pandemic?
So just to reiterate, I mean, this is an incredibly challenging time for all of us, and something that none of us, of course, have ever experienced before, and something that we're all working together on overcoming. What I recommend to my patients is focusing on personalized medicines as opposed to medications or a specific type of therapy. I think now is a time when young folks need to explore what makes them feel good and what reduces stress, and alternatively, what is contributing to stress and anxiety. And there's no one size fits all model. I think that is different for everybody that I work with because everybody is so unique, and it's different for me too. And now is a time to experiment and explore and figure out what those things might be. We started off this meeting by talking a little bit about some of the things that we've never done before, and I think that's an example of what I would describe as personalized medicine. For one person, it might be reading a book or gardening. It might be doing exercise. And it might be a combination of those things. And at the same time, I think there are things that we are all learning increase our anxiety and increase our level of stress. For example, I've taken breaks from social media, I've taken breaks from watching the news, and I think that each one of us needs that. And so my advice would be to find somebody that you trust, who can be supportive, and bounce some of these ideas off them and work with them on figuring out what makes you feel good and what's making you feel bad, and try to find a nice balance so that we can continue to power through this challenging time, being able to identify what makes us strong and our strengths and where we are resilient. And also some of those areas that are a little bit more challenging. That would be advice, I think, that is sort of, that although everyone is unique, I think anybody can benefit from that message and that type of advice.
Definitely. That's something maybe we've all had to do it. I've had to also take breaks, particularly from the news. I spent the first 3 weeks glued to my phone, reading every headline, and realized it was making me extremely anxious, and I couldn't sleep and all of that good stuff. So I had to take a break, and now I probably don't read enough news, but I've limited it to what I feel that I need to know. So I need to know local things. I need to know about restrictions changing in my local area, but I don't need to know, all the numbers at every hour.
Yeah, and
so,
just to add, I think that evolves, right?
Yeah.
It's possible that 1 week, one strategy is the right way to go, and another week that has to change depending on how we're thinking and feeling and what's going on in the world. And so I think that's part of the process. This is a learning process for each one of us, and a supportive network to explore some of these things is really a good way to go.
Definitely. Danny, I'm curious about you, both in terms of how you're encouraging people as you're talking with folks in the program who you're supporting, and then if you even want to touch on your personal experience as well, moving through, particularly being centered, at the epicenter of this, living in New York City. I'd love to hear your perspective of how you've been staying well and how you've been encouraging others.
So yeah, I think right now is also a unique opportunity to kind of understand what exactly telehealth is. So what I do now feels a lot different than what I did before all this happened. Before, it felt more the ability to have more space. And now it seems that I'm not isolated, but it seems very much that there's a lot of barriers or walls that that have to be taken care of before I can make a connection as I did before. One of the things that I really like is platforms like Zoom. I think they're very nice to see another person and see their reactions, and even just to try to simulate that kind of connections that we have. The peers that I talk to, a lot of the stuff that we talk to are activities. I think those are important. Chatting with people, hearing other people's stories, hearing about what they're doing, like if it's painting, if it's finishing school. Some people are graduating, especially young people. And I think all these stories are very important because they inspire me, when I hear them. And then also the difficulties are important to hear, because I feel that when I support somebody, when I help them, that helps me a lot. It helps me understand kind of where my head is at, how do I want to tackle a similar problem when it happens to me, or how I tackled it before. So those are the kind of the stuff that I'm trying to bring to the table, is that these things need to be talked about, and they're very helpful, I feel, for people. And like Dr. Birnbaum said, it's also a lot of self-discovery is important. I think knowing where you don't want to go to, where you do want to go to. For me personally, I have like a scheduled time in the morning. That's usually where I get most of my mail, and before I go to bed, and in between is just pretty much just me. And then also for me, it's knowing that when this is over, it will be a different experience. I think that's the kind of thing I can look forward to is that I feel that comparing what it was before, now, and after will be important when we have these discussions, just because there's a lot of experiments that can be made, like kind of like emotions that I don't think I would have gotten without this experience. So for instance, I'm kind of introverted. I kind of stay on the computer all day. I don't really talk to people. I don't really socialize, but this has made me seem more extroverted. I actually now want to go out to the park and look at the trees and actually breathe in fresh air, walk a little bit, socialize more, and even like give hugs. I wasn't a hugger before, but I definitely am missing those kinds of interactions. So those are the things I think about.
No, those are fantastic. I can definitely relate to that. I think we're all missing hugs. I feel incredibly grateful that I'm sheltering in place with 3 other people with my family, and there's hug opportunities. I have friends and family who don't have those opportunities, and I do think the isolation on your own can really add to the stress that's happening today. Okay, perfect. So let's shift gears a little bit and talk a little bit about getting help, what it looks like to get help. A lot of people reach out to us about themselves or loved ones, asking when an issue that they're sensing in their loved one crosses over from in severity, from something that might just be stress or typical kind of teen angst or behavior stress, to a problem that looks a little bit more like a diagnosable case of depression, anxiety, psychosis, that's not going to go away on its own without some form of more, formal support from a professional. So Dr. Birnbaum, I'll open this up to you first. Can you share some common signs and symptoms, ways for parents? I know we also have a teacher on with us today. Ways that they can look out for their kids, their students, people in their community or in their friend circle, to help us understand how to think about severity and when to seek help.
Sure. So mental illness can present itself in a lot of different ways in a lot of different people. And certainly it also depends on the type of mental illness that we're referring to. So someone who might be developing a depressive disorder may be experiencing some different symptoms than somebody who is developing a schizophrenia spectrum disorder or a bipolar disorder. But in general, the things that I would look for are significant, noticeable changes in mood, thought, behavior that are consistent. So not things necessarily that happen for a moment and go away, but changes that are persistent, lasting for a few days, a few weeks. Those are some potential red flags. Things that we often see are a decreased interest in things that used to provide pleasure, noticeable changes in sleep habits or eating habits or concentrating, perceptual changes. Sometimes people notice that colors look a little bit different or sounds sound a little bit different. Some of the things that we see at the early treatment program are increasing preoccupation with some ideas that may be a little bit unusual, atypical. And I realize some of these things that I'm saying occur in lots of different people at lots of different times. And again, I think the key question becomes when to reach out for help and at what point. And like I said before, one of the things that we look at is the persistence of this experience. Is it intermittent, or is it lasting? And even more so than that, it becomes the impact on somebody's life. So all of us experience some sad mood sometimes, but when that low mood starts to really impact day-to-day life, then it becomes a little bit more worrisome. In general, I would say that if you have a concern, then that's worth exploring and reaching out for help, much like you would if you had a medical concern. I think that many people feel comfortable reaching out to a primary care doctor, even if it's a silly question, just to make sure that there isn't anything to be worried about. And so I hope that one day in psychiatry, we could do something similar, where if there was a concern, whether or not it needs attention, professional attention, there would be a system in place where we could present those concerns and obtain the answers to whether or not we need a higher level of support, professional support. And how exactly we do that, I think, becomes the next big question, because it's different for different people in different states with different level of resources. But there are a lot of resources out there, and I would say step one, if you're worried as an individual, or if you're worried as a parent, I would trust your concern, and I would seek advice, and that advice, either a primary care doctor or somebody else who has who can provide that guidance as to whether or not professional psychiatric care is required.
No, that's helpful. Thank you. And Danny, how about you? I mean, just from a personal perspective, I'm curious what this looked like for you. I think you mentioned that you did when you were experiencing some early symptoms, you did reach out to your family. Um, but I'm curious what advice you would have for a young person who may know they need help, they know that something's not right, but they haven't reached out yet. They haven't shared it with anyone.
Yeah, for me, I think it was that even I was noticing it. I was very erratic would be the best word to describe it. I had a lot of energy. I couldn't concentrate. My thoughts would speed up very fast. It's very hard to describe kind of like the experience, but the best thing that helped me was that the brief moments that I noticed that people were trying to help me kind of crystallized into me wanting to ask the question, like not if there was something wrong with me or anything like that, but more of something feels different, like something's going on and I can't explain it, but there is something going on. And I think it was that at that point when I was aware for a brief moment that I felt that I was getting the help I needed. So I have a big family, so I had a lot of support, and eventually when I went to the doctor, the thing that struck me the most was that uh, almost everybody was trying to get me to say what was going on in my mind and get me to say what I was thinking. And I think that kind of feeling was very valuable to me. That kind of feeling of what I'm saying is being heard and being listened to, and I matter. Like my thoughts matter, my ideas matter, and my who I am matters. And I think that's the most important thing. If you feel that you don't have anyone to talk to, I think that kind of becomes stigma. Like it stigmatizes you into feeling that you're going to be blamed for something that you technically have no control over.
Mhm.
So I think those kinds of things, if that's what I would say to somebody, is that feeling that you're alone feels a lot different when you see somebody else that went through it, or when you hear somebody else talk about it, and there are just certain things that just click. Vividly remember the first group I ever went to,
Mm.
and it was part of the on-track program, and there was this picture about schizophrenia, and it was pretty much a bunch of lines all connected, and it spoke to me. The art spoke to me, and I think there were 3 or 4 of us, and each one of us said like that almost explains it perfectly. It's that like almost everything was connected and everything was so hard to decipher, but it was so clear if you for a brief moment. And I think those are the kinds of stuff that, like anything, like music, like when somebody shares that like music helps them calm down, like I just go back to the days where I spent hours and hours on Pandora listening to music again and again and again, almost for hours. And those things I will always try to remember and keep to my heart, because those are the things that help me.
Oh, that's fantastic. I love this idea of some of the things that often help us most are these shared experiences. So being able to relate to others through art or through music makes so much sense. Whether you're in the midst of a major struggle or a stressful time or whatever it is, I think using those types of mediums to relate and to connect and see our experiences as shared is so meaningful. Um, I'm curious, this is one of the things that came up in the poll, what each of you would say about kind of from the perspective of a friend or a family member. We hear a lot from parents, from siblings, and from friends who are concerned and they want to help someone, but they're not sure how to talk to them about it. And so I'm wondering if maybe starting with you, Danny, if you could almost reverse what you just kind of shared about you had to at some point sort of disclose what was happening for you. I'm curious, what it could look like if someone else was noticing symptoms or signs that they were concerned about and needed to broach the subject, needed to bring this up. I'd love to hear kind of from your perspective, what would be a helpful way to kind of see, to experience a teacher or a parent, a friend, opening this discussion with you?
So for me, I think almost everybody noticed. Everybody noticed something was different. But the two that come to mind almost immediately were my parents. My parents are divorced. They're not together anymore. And this didn't really bring them together, but I honestly felt that their perspective on each of them really shared and showed me almost with absolute proof that they love me as their son, and also my sister. But my father, he never really spoke to me directly, but he let me talk. And I think that was important, that kind of support where I felt that he was almost treating me as his equal. I think that was very important. And my mom, I think the best thing about her was that she shared that she almost showed that she would never leave my side. Like she was very supportive, and she was very like a mother. She was a caregiver, and I think those kinds of perspectives helped me a lot, because also my sister, she would always keep me in mind. She would always try to bring me in, take me to the park and to run and stuff like that. She always try to bring me into the world. I would go now to the family dinners more than before, where I used to just go to my room and just go to sleep or do something else. My friends, they picked up the phone and went to the movies with me. So those things helped me, but direct conversations would probably be my father. So he's the one that really helped me. He's the one that I felt, I think only he could do it. I think only he could do it because I have a trust with him that I don't think I have with many people. And I think that he showed me that trust was valid. And I think that's like Dr. Birnbaum said earlier, that person that you can trust. I mean, it is a risk. I won't say that it isn't. There are some people that sadly will look at you differently, but I think sometimes the risk will be worth it, because you can be surprised presently, like I was, and I don't think I'll ever say a bad word towards my father just because he did that.
It's beautiful. Thank you for sharing that. Dr. Birnbaum, what would you add to that? I'm sure that you have concerned parents and other individuals reaching to you asking this very question: how can I reach my son or daughter with my concern? What do I say?
Yeah, I do get asked this question quite a bit, and I think the key here is to talk about it, and bring up concerns in a genuine and authentic, but also caring and non-judgmental way. And it can be very challenging, especially if you're a concerned loved one. You're worried about what might be going on. But I think that the best advice that I can give is to let the loved one know that you are there to support them no matter what, that you love them no matter what, that you're worried about them, and let them know what exactly you're worried about. And I think that it's easy for me to say. It's a very hard conversation to actually have, but I encourage parents and siblings to open up that door and to make sure that they know, that their loved one knows, that the door is always open. So this is not just a conversation that happens once. Likely it's a conversation that has to happen multiple times. But what I've learned is that usually the young person is also worried about themselves. Whether or not they explicitly state it, there is usually some common ground there, that the parents and their child are both worried. It may not be that they're worried about the same thing, but they all have concerns. And I think it's about finding that shared common ground and opening up the window and keeping to pursue that and keeping the lines of communication open. A challenging task, but something that needs to happen in order to really be a team here, and ensure success and the best possible outcome.
No, that's fantastic. I love the idea of it. I think both of you said it in different ways of this is not a one-time conversation, but it's really this opening of the door with this unconditional support and very likely love for this person, and letting that be, letting that stand, and coming back to that is beautiful. I'll also say for folks who are looking for ideas of even words to use, we do have a page on our website at strong365.org that deals with this, where it's helping a friend. You could certainly apply the same idea if you're a parent or an educator, but check it out. There's some ways to open up the conversation there as ideas. So Dr. Birnbaum, you talked about earlier, there's not a one-size-fits-all approach to mental health recovery. There are a lot of therapies that are targeted at, various different types of challenges that people face, like anxiety and depression and psychosis and OCD and so on and so forth. There's also a lot of medications available, and we hear about them oftentimes on TV, or a friend is taking something or whatever. There's a lot of information that's sort of floating out in the world, whether that's exchanged through people or online. And I think it can get pretty confusing for people. And so I wonder if it could be useful just to talk for a moment. I'd love to hear just a little bit of information from you on, if I'm struggling, how do I know, what kind of psychologist to go to? Do I need a psychiatrist? Who do I go to first? How do I find one? And I know that how do I find one is an impossible question, because we all live in different places and there's sort of various pathways to care, and none of them are great in America because we have this really complex and troubled, especially mental health care system. But I would love any general advice that you could offer to individuals who are considering seeking care. Like, how do you even begin to conceptualize what kind of provider to begin to look for?
Right. That's a good question. And there are lots of different types of providers, especially within the world of mental health. And that makes it a little bit more challenging because there are psychiatrists and social workers and psychologists, licensed mental health counselors, nurse practitioners, etc. And that makes the landscape even more confusing. I would say that for each individual person, if they have access to a medical provider that knows them, a primary care doctor, for example, I would start there, but not everybody has access to a primary care doctor. For other people, I recommend that they look at their insurance to see who is within their network, but I also know that there are a ton of issues there too. In general, my advice would be to keep asking a medical professional for input, and that it's not up to it wouldn't be my expectation that any individual person would know if they need to see a psychiatrist or they need to see a psychologist or they need to see somebody else, but rather express their concern, obtain a professional evaluation either from a psychiatrist or a psychologist, and they would be able to refer you and help you navigate the landscape, which can be somewhat confusing. But it's different for each individual person. It depends on the symptoms. It depends on the diagnosis. And I realize even my answer, as I'm saying it, is a little bit complicated. So I think that we all know that there's a major problem with the system. There are agencies and efforts to fix and identify solutions. Again, there's no one-size-fits-all model, but I would encourage anybody who's concerned, again, to express those concerns. I think early on, I don't think it necessarily matters who you see. It's more important that you see somebody, and then that person will help you come up with a treatment plan. And when I say somebody, I mean somebody within the scope of the mental health landscape that I was just talking a little bit about. If there are any follow-up questions, yes. Yeah. start somewhere, and then hopefully that
Yeah.
person will be able to help guide you.
Mm-hmm.
But also, if there are any questions about that answer, I'd be happy to answer them directly also.
Yeah, I just want to make a plug too for the Q&A. Please feel free to use it. We have a few more submitted questions that were submitted prior, and we can go through those, but we'd love to answer your questions directly too. So we have one eye on Q&A, so please don't be shy. Submit your questions no matter what they are. They may have nothing to do with anything that we just covered. That's okay. If it's within the specter of mental health and youth mental health specifically, you know, these are the folks to answer. So please use the Q&A. We were just talking about the mental health system. So while people are thinking about their questions, we'll go through one more question for you both. Ooh, okay. Ooh, wait, maybe I'll pause on that because this is related too, and I just see a really great question from the Q&A for Danny. So Danny, this person would love to hear more about the role of a peer specialist. This is such a great question. It's not something before I entered this world working in mental health, I did not know what a peer specialist is or what they do. So we'd love to share more about that role.
Yeah, I also didn't know what a peer specialist was. But like I said earlier, during the end of my time in the on-track program, I kind of was looking for some more opportunities. And also I had a conversation with my mother, and she told me that it was a resource that was very valuable. And so I asked the C's, which is they are a support employment and education specialist. They help you with school, and they help you with finding employment or volunteer work. And I learned about the peer specialist role. I went through the trainings, and to put it like in like almost a catch-all, as peer specialists or peer advocates, we try to be the person that a peer is most comfortable kind of speaking with. Like we are not there to judge. We are not there for ourselves. I don't go there to better myself. I'm there to speak about my experience and what I went through and what I did and what my thought process was, and also what I found helpful and what I didn't. I'm almost there to be like a sounding board. I am very willing and hoping to share what I went through, but also I am willing to learn. I'm willing to see that I am not the only person that went through the mental health field, and my experience might be different than somebody else's because my situation was different. But I think that idea that we all share, like as a community, share life, I think that is powerful. And me hearing about somebody's problems or their hopes and dreams helps me help the next person, and hopefully down the line, this will allow all of us to be able to share with honesty, and also with a bit of hope and almost dreams of what we can do together as not only staff but as family members. You know, I think one of the hardest things to see as a peer is when I see a parent, because you know it's very easy for me to see my father and my mother there, and my sister. You know, it's not that they can't do anything, but it's very much that I would want to give them as many tools as possible to be able to demonstrate that not only are they there to support, but they can do something, and I think they can. So I think that's technically what a peer does. Long story short, we're kind of a way to connect all these services that are available to a peer, to a participant, and hopefully they can see that these services are valuable and can be used very effectively.
And is it up to the participant to see you at a certain time, or is there a regular meeting with you, or are there groups? How does that work?
Both. It's completely up to the participant. I try to introduce to as many of them as come through the doors, but also I am pretty much in almost every group, and I think that gives me the opportunity to kind of be a familiar face. So even I think the best experience I've ever had was, it was around 2 or 3 months after I started that a participant flagged me down, said hi, and greeted me. I felt good because they were finally comfortable, I felt that somebody was finally comfortable to approach me. And we talked about just a daily interaction. And I think that gave me the confidence to seek out people. So that gave me the confidence to be the person that comes in and sees that somebody's alone, sits down and tries to have a chat and tries to, get somebody to talk, get somebody to share what they're thinking. And sometimes they don't want to share. Sometimes they just want to talk. And I think both are valuable. So, yeah.
And how about your perspective on the peer specialist role, Dr. Birnbaum? I know this is a role that has evolved over the past maybe decade and even less. I think it's evolving very quickly now. What is it like being a psychiatrist working alongside peers? How do you work alongside it? I'd love to hear a little bit more about that.
So I was going to add that Danny doesn't just contribute to the patient and family experience, but he contributes to the team experience and in some ways transforms what we do behind the scenes. And I think it's an incredibly valuable perspective to bring to the work that we do. One of the things that I think medicine in general struggles with is that it could become overly distant, overly medicalized. One of the things that we work very hard to do, especially with early intervention programs and at the early treatment program, is to make it feel a little bit less clinical, a little bit less sterile. We try to move away from medical jargon because we also know that could translate into the conversations that we have with the folks that are coming to see us for help. And Danny really helps to keep us in check. And it is an incredibly valuable service for us too, to always be thinking about, well, how might this individual that we're working with, how might they be interpreting what we say and what we do? How can we even be contributing as medical professionals to stigma? And how do we make sure that the conversations that we're having, the words that we're using are in line with what we are thinking and what we're hoping to achieve. And I think that including that perspective at all times is really something that makes this program and this position really unique.
Yeah, absolutely. I mean, I think it's critical for everything that we just said about shared human experiences. I mean, to see your experience reflected in someone else, even though it's not, like you said, Danny, exactly the same. Everybody, struggles in different ways. But nonetheless, it's certainly validating to have you as a part of the team, I'm sure. We have about 8 minutes left, so please ask us questions. We would love to answer your questions. I'll move on, but we'll pause if we see a question come through. I want to ask each of you you'll have to keep your answers as short as you possibly can, because it's a very big question and it's very impossible to answer. So with that, each of you, in addition to your clinical roles, you have both been serving in the overall kind of landscape of mental health as advocates for change. And we've already brought up a number of things in the system itself that absolutely need to change. But I'm curious, we'll start with Danny, if you could change just one thing about about mental health care system in America and how care is delivered, what would it be?
Very quickly, probably the familiarity people have with what it is to be a participant or a patient and what that means, kind of like what you do behind the scenes, but also how much are you willing to share about that? I think those are very important, especially because I didn't know what a peer specialist was about a week before I started the position, like not started, but heard about it. So I think those kinds of discussions should be broader and should be have well before the time that you kind of need the position or even need any services.
Oh, that's great. That's fantastic. Well, then I'm glad really glad that you're here because we are sharing about the peer specialist role. I love that someone asked more about it. So that's fantastic. And how about you, Dr. Birnbaum? If you could change just one thing. I know it's hard.
Yeah. I mean, I would change everything, but if I had to pick just one thing that I believe would drastically transform everything we do, it would be to remove the stigma that is associated with mental illness, because I think that really impacts everything from the insurance companies to the hospitals to the trajectories to care, to asking for help. I think if we can really revolutionize our understanding of mental illness and the stigma that is still unfortunately associated with that in some folks, I really think that would go a tremendous way in impacting the rest of the services that need to be fixed as well.
Absolutely. Yes, I completely agree that stigma is a huge barrier for people, whether that's, you know, on behalf of yourself, seeking help or talking with a friend, or as a parent, a friend, whatever. We need to be able to have the conversation. And like you said earlier, Dr. Birnbaum, it's critical just to talk to someone. And that's hard. It's hard to get to that point. And I can share that even for myself, I think a lot of us do this, you know, I will wait until something is fairly developed in its severity to actually say, you know what, this is really hard and I need some help. So I think the more that we can get used to being vulnerable enough to share about our mental health, and the safer that we can feel in our society to do that, the better. And again, this is a big reason why Strong 365 exists, to share good mental health information, resources, and connect young people to care. I want to thank you both so much for being here today, spending your time and effort with us. It's been a really fun conversation for me. I hope that our participants enjoyed as well. Please do visit our strong365.org website for more information and to learn more about not just mental health, but also how to get involved. You can learn more about joining our community and jumping on our social channels and being part of this conversation all the time. The replay of this will be available on YouTube. We'll get that out. If you know someone who would be helped by watching it or learn something, we'll pass that along. And if you have questions after this, please feel free you can comment on any of our channels and we will respond to you there. Or you can certainly also email us at info@strong365.org. Thank you again, everyone, for joining. Thank you to our co-hosts here, and be well, everybody. Thank you so much. Bye-bye.
Thank you.
Thank you.